Hello and welcome everyone. Welcome to this video on definition series in biochemistry part 12. In this video, I'll be informing about some very simple and most frequently asked definitions associated with protein metabolism. So let's begin. Transamination. Transamination is the exchange of the alpha amino group between one alpha amino acid and another alpha keto acid, forming a new alpha amino acid, catalyzed by enzymes called aminotransferases or transaminases. Deamination. It is a process by which amino group from the amino acids are removed as ammonia. Oxidative deamination. It is the liberation of free ammonia from the amino group of amino acids coupled with oxidation, hence oxidative deamination. This takes place mostly in liver and kidney and is catalyzed by the enzyme glutamate dehydrogenase. Non-oxidative deamination. Some of the amino acids can be deaminated to liberate ammonia without undergoing oxidation. Trans-deamination. Transamination that occurs in most of the cells, followed by oxidative deamination, mostly occurs in the hepatocytes. These two metabolic processes are physically far away but physiologically coupled, hence trans-deamination. Transmethylation. The transfer of methyl group from active methionine, that is S-adenosyl methionine, to an acceptor molecule is known as transmethylation. Urea cycle. The metabolic cyclic pathway that detoxifies ammonia to urea by liver cells. The cycle was elucidated by Hans Krebs and Kurt Hensleit. Hence, the cycle is also called as Krebs-Hensleit-Urea cycle. As ornithine is the first member of the reaction, it is also called as ornithine cycle. The two nitrogen atoms of urea are derived from two different sources, one from the ammonia and the other from alpha group of aspartic acid. Hyperammonemia. The accumulation of excess ammonia in blood. Normally it is less than 50 microgram per deciliter, and body fluids due to deficiency of the urea cycle enzymes, namely carbamoyl phosphate synthetase 1 and ornithine transcarbamylase. Non-protein nitrogen or NPN. The term NPN refers to all the nitrogen containing substances other than proteins. These include urea, which is most abundant, creatinine, creatine, uric acid, peptides, amino acids, etc. In healthy person, NPN in blood is around 20 to 40 milligram per deciliter. Blood urea nitrogen is equals to half of NPN, or NPN is equals to twice blood urea nitrogen. As molecular weight of urea is 60, half of it, that is 28, is nitrogen. So two nitrogen atoms are present in urea molecule. Hence NPN is equals to twice blood urea nitrogen. Non-ketotic hyperglycemia. It is due to the defect in glycine cleavage enzyme glycine synthase of catabolic pathway. It's characterized by elevated serum glycine levels. At high levels, glycine is an inhibitory neurotransmitter leading to neurological defects. Primary Hyperoxaluria. It is due to the defect in glycine transaminase enzyme coupled with impairment in glyoxylate oxidation to form it. This disorder is characterized by increased urinary oxalate, resulting in oxalate stones. Deposition of oxalate or oxalosis in various tissue is also observed. Glycenuria. It is an inborn error of metabolism characterized by increased excretion of glycine through urine. Despite plasma concentration of glycine is normal. Glycenuria probably occurs due to a defective renal reabsorption. It is characterized by increased tendency for the formation of oxalate renal stones. Maple syrup urine disease or MSUD. This is a metabolic disorder of branched chain amino acids. The urine of the affected individual smells like maple syrup or burnt sugar, hence the name. The maple syrup urine disease is due to the defect in the enzyme branched chain alpha ketoacid dehydrogenase. Plasma and urine concentration of branched chain amino acids and their keto acids are highly elevated, branched chain ketonuria. The disease results in acidosis, lethargy, convulsions, mental retardation, coma, and finally death within 1 year after birth. Phenylketonuria or PKU. PKU is an inborn error of phenylalanine metabolism associated with the inability to convert phenylalanine to tyrosine. It is caused by a genetic defect in phenylalanine hydroxylase enzyme, which is the first enzyme in the catabolic pathway of phenylalanine. It's a classic PKU type 1. PKU can also be caused by a defect in dihydrobiopterin reductase, which catalyzes the regeneration of tetrahydrobiopterin. It's atypical PKU type 2 and type 3. A defect in dihydrobiopterin synthesis causes Hyperphenylalanemia type 4 and 5. This disease is characterized by urine with mousy odor, mental retardation, hypopigmentation, convulsions. Tyrosinemia. 3 types of tyrosinemia are Tyrosinemia type 1 or tyrosinosis or hepatorenal tyrosinemia, Tyrosinemia type 2, Richter-Hanhart syndrome, and Tyrosinemia type 3, neonatal tyrosinemia. Let's see them one by one. Tyrosinemia type 1. Due to the defect in the enzyme fumarate acetoacetate hydroxylase, there is an accumulation and excretion of tyrosine and its metabolites such as para-hydroxyphenyl pyruvate, para-hydroxyphenyl lactate, para-hydroxyphenyl acetate. The clinical features are liver failure, kidney dysfunction, hence it is also called as hepatorenal, cabbage-like odor, hypoglycemia, and mild mental retardation. It is often fatal in the early years of life. Tyrosinemia type 2 or Richter-Hanhart syndrome. It is caused by genetic deficiency of the enzyme tyrosine aminotransferase. So tyrosine is not metabolized by its routine pathway and is converted to para-hydroxyphenyl lactate, N-acetyltyrosine, and tyramine. Increased excretion of tyrosine and tyramine in urine is observed. The clinical features are mental retardation, keratosis of Palmar surfaces, painful corneal lesions, and photophobia. Tyrosinemia type 3, it's also called as neonatal tyrosinemia, It is caused by the absence of enzyme p-hydroxyphenyl pyruvate hydroxylase. This deficiency may cause transient hypertyrosinemia in newborn. This will respond to administration of ascorbic acid and dietary protein restriction. Hawkinsinuria. It is an autosomal dominant trait and is due to dysfunction of PHPPA oxidase. It is characterized by the excretion of Hawkinsin in urine. It's a derivative of PHPPA. What is PHPPA or HPPA? Hydroxyphenyl pyruvic acid. Alkaptonuria. It is an autosomal recessive condition due to deficiency of the enzyme homogentisate oxidase. There is an accumulation and excretion of homogentisic acid or HGA. The clinical features are blackening of urine on standing because oxidation of homogentisic acid to benzoquinone acetate occurs. It's polymerized to black colored alkaptone bodies. Ochronosis, that is deposition of alkaptone bodies in intervertebral discs, cartilages of nose, pinna of ear, etc. And arthritis, deposition of black pigments in joint cavities. Albinism. It is an autosomal recessive condition due to the absence of enzyme tyrosinase. There is an absence of melanin formation from tyrosine. The clinical features are low pigmentation in skin and hair. So individuals have white hair, photosensitive skin. The skin may show presence of nevi and melanomas. Photophobia, nystagmus, and decreased visual acuity. The ocular fundus is hypopigmented and iris may be grey or red. Hypopigmentation. In some individuals, a reduced synthesis of melanin instead of total lack is often observed. Hypopigmentation disorders may be either diffuse or localized. Diffuse hypopigmentation. A good example of diffuse hypopigmentation is oculocutaneous albinism, which is mostly due to mutations in the tyrosinase gene. The degree of hypopigmentation depends on the type and severity of mutated genes. Localized hypopigmentation. Vitiligo and leukoderma are the important among the localized hypopigmentation disorders. Vitiligo is an acquired progressive disease with loss of pigmentation around mouth, nose, eyes, and nipples. Leukoderma is comparable with vitiligo, but lack of pigmentation usually begins with hands and then spread. Graying of hair. Graying of hair is due to lack of melanin synthesis, which usually occurs as a result of disappearance of melanocytes from the hair roots. Argentaffinomas. Argentaffinomas or carcinoid tumor is a serotonin secreting neoplasm. Up to 60% of tryptophan, normally 1 to 3%, is diverted to serotonin formation. Therefore, niacin deficiency may also be seen in carcinoid syndrome. So pellagra-like symptoms may also be seen in them. The patient complains of flushing, sweating, intermittent diarrhea, bronchial constriction, and often has fluctuating hypertension. Hartnup's disease. This disorder was first described in the family of Hartnup, hence the name Hartnup's disease. It is a hereditary disorder of tryptophan metabolism. It is characterized by low plasma levels of tryptophan and other neutral amino acids and their elevated urine excretion. The clinical symptoms include dermatitis, ataxia, mental retardation, etc. Cystinuria. Cystinuria is one of the most common inherited disease characterized by increased excretion of cystine, 25 to 40 times the normal. Along with cystine, lysine, arginine and ornithine are also excreted. Therefore, it is also known as cystine lysinuria. In cystinuria, a specific carrier protein system becomes defective, leading to the excretion of all the above 4 amino acids in urine. Cystine is cystine is relatively insoluble, and increase in its concentration leads to precipitation and formation of cystine stone in kidney and urinary tract. Cystinosis. It is a familial disorder characterized by the widespread deposition of cystine crystals in the lysosomes, hence also known as cystine storage disease. Cystine accumulates in liver, spleen, bone marrow, WBC, kidneys, cornea, and lymph nodes. There is an abnormality in transport of cystine which is responsible for the accumulation. Homocystinurias. Homocystinurias are a group of metabolic disorders characterized by the accumulation and increased urinary excretion of homocysteine and S-adenosylmethionine. Plasma concentration of methionine is increased. Homocystinuria Type 1. It is due to a defect in the enzyme cystathionine synthase. Accumulation of homocysteine results in various complications, thrombosis, osteoporosis, and very often mental retardation. Further, the deficiency of cystathionine is associated with damage to endothelial cells, which might lead to atherosclerosis. The patients of the homocystinuria have high levels of homocysteine and usually die of myocardial infarction, stroke, or pulmonary embolism. Homocystinuria Type 2. Homocystinuria Type 2 is characterized by the deficiency in the synthesis of N5-methyl tetrahydrofolate due to defective N5-N10-methylene tetrahydrofolate reductase enzyme. N5-methyl tetrahydrofolate is required for the remethylation of vitamin B12. Homocystinuria Type 3. Homocystinuria Type 3 is characterized by the deficiency in the synthesis of methyl B12 due to defective N5-methyl tetrahydrofolate homocysteine transmethylase enzyme. Methyl B12 is required for the remethylation of homocysteine to form methionine. Homocystinuria Type 4. Homocystinuria Type 4 is primarily due to a defect in the intestinal absorption of B12. Methyl B12 is required for the remethylation of homocysteine to form methionine. Cystathioninuria. Cystathioninuria. It is due to the deficiency of enzyme cystathionase. Cystathionine level increases in blood and its urinary excretion is also elevated. Clinical symptoms associated with cystathioninuria are mental retardation, anemia, thrombocytopenia, and endocrinopathies. Hyperprolinemia. Hyperprolinemia type 1, it is due to a defect in the enzyme proline oxidase or proline dehydrogenase. Hyperprolinemia type 2, it is due to a defect in the enzyme glutamate semialdehyde dehydrogenase. Both types results in increased blood and urine levels of proline. Mental retardation occurs in half of the known cases, but neither type is life-threatening. Histidinemia. It is due to a defect in the enzyme histidase. Histidinemia is characterized by elevated plasma histidine levels and increased excretion of imidazole pyruvate and histidine in urine. Most of the patients are mentally retarded and have defect in speech. As usual friends, I am thankful to all these resources for making this video possible. Thank you so much. Thank you friends. Thank you for watching this video. Be happy, healthy and stay safe. And remember, biochemistry is easy. Thank you so much.